Now we're going to talk about post-op hip restrictions after a posterior hip replacement. Now sometimes we do hip replacement through the front, sometimes we do it through the back. If we do it through the back, called the posterior hip replacement, there are 3 things that we don't want you to do. Number 1, we don't want you to bend your hip past 90 degrees. What does that mean? I can bend my hip, bend it, bend it, bend it, bend it, bend it, but once my thigh and torso form a square angle that's 90 degrees, that's the maximum bending. So you can bend up to 90, but don't bend past 90. Why not? Because it can dislocate. Number 2, I want you to keep your legs apart. Remember that pillow that you had when you woke up from surgery in between your legs? Pretend that that's there, doing what we wanted to do, which is to keep your legs apart. So part of keeping your legs apart is making sure that they don't touch each other. They don't come together. I'd like you to imagine a force field down the center of your body, and the leg should never come to or across that force field. So yes, I want you to keep your legs apart. I don't want you to touch them, and I certainly don't want you to go even further and cross them. So no bending past 90, no crossing your legs, and lastly, I want you to keep your feet and knees pointed out. We call it the Charlie Chaplin walk. If you're walking with your knees and hips pointed out, that's safe. If you point your knees and feet inward, so they're sort of pointing towards each other, that's called pigeon-toed, and that's dangerous. So, in summary, no bending past 90, no bringing your legs together or crossing them, and always keep your feet pointed out. And that's that. What if I'm sitting in a chair? Can you tell me how much I'm bending my hip right now? Basically 0. It's fully straight. But as I sit in this chair, you can see that my hip is bent to 90 degrees. That's the maximum. I could be safe by kind of slouching in my chair. Now it's not quite bent to 90, and that's a safer position. But I can go up to 90. But one thing is this, let's say I want to tie my shoe, or I want to lean down and grab the thing on the floor over there. I'm already at 90 degrees. If I decide to bend forward like this, I'm past 90. It's something you're going to have to be aware of as you're progressing through your days after your hip replacement surgery.